Hello, welcome to News Centre. I'm Parikshit Luthra. Health Secretary Rajesh Bhushan has said India was seeing an average of 966 new COVID-19 cases per day. That's significantly higher than the 108 cases per day in February. India has over 7,600 active cases currently. However, India's graph is much lower than the daily cases reported in the US, Russia and China. The Health Secretary said there is no evidence of higher hospitalization or mortality, adding that the government is prepared for any uptick. Also, the Prime Minister held a high-level review meeting on COVID-19 and influenza cases in the country. To discuss this further, we are joined by Dr. Vishal Rao, member of the Genomic Surveillance Committee of Karnataka COVID Task Force, and Dr. Vaishali Solao, Head Critical Care at Fortis Hospital. Dr. Vaishali, if I can begin with you. There has been concern about the rise in influenza cases, rise in COVID cases over the last few weeks. How concerned are you? How concerned should we be?
So, influenza every year does have a peak of cases. And what we are seeing now is also a similar peak. It happens every year all around the world. The H3N2 is the influenza virus, which is currently most prevalent right now. And the COVID also now, as per the Ministry of Health, is the number of cases are rising. Yes, it is a matter of concern, but not a matter of panic. People just need to take more and more precautions. And the only way out of this is basically more and more precautions and vaccination. So it is a matter of concern, but not a matter of panic. And easily precautions can easily avoid, can be taken so that people don't get it.
All right, matter of concern, but not a matter of panic. Dr. Vishal, coming to you, the XBB.1.16 variant, does it have the potential to trigger a new wave of COVID-19?
Thank you, Parikshit. For the last couple of, I would say, years, we've been tracking the virus, and the last couple of months has been very interesting to see the evolution of the virus. Two important points that come to light for us globally when you look at the data is that the recombination is a concern which every virologist and epidemiologist is concerned about, where two separate strains of the virus get together and lead to a new strain. The other important thing which we are worried about is antibody-enhanced disease, AED, which is leading to what is called as depleting quality as well as quantity of antibodies in us who have been vaccinated either twice or thrice, because we have been vaccinated with the first strain, that is the D614G of the virus. And what is happening right now is completely a new strain of the virus, which is a completely new version altogether. So at this juncture, the XBB 1.16 and again discussions around 1.9 and others continuously are happening, with higher rise in the spread and in the transmissibility that they're having. For example, in Karnataka, from Feb last month till now, there has been a jump from 1% weekly positivity rate to 3%, whereas the mortality rate has not changed. So while we are not concerned and we do not see any reason for us to hit the panic button, and we will continue to see new variants come up very regularly, we'll see new variants come up very commonly. It's going to be very crucial for us to monitor them to understand which one of them will reach a critical point to create infectivity like Delta. And when we say that there are some other important scientific facts, now the Omicron strains that we are seeing now does not have the access to the TRAMPus protein pathway, which the earlier Delta had, and that's why it was able to easily enter the lung. So we don't expect that there is going to be any kind of a sudden change in the biological behaviors of these new Omicron variants, because they seem to be infecting their nose and throat region and not the lung. And that's why we feel that we will be saved from the wrath of the problems like that we saw in Delta. But vigilance needs to be continued, and genomic surveillance is the answer, not only now for the COVID, but also, like Dr. earlier said, for the influenza strains to keep monitoring their virulence. If we continue to do this, I'm sure we'll be very
Right.
better, well prepared. Karnataka has already set up the Center for the Pandemic Preparedness. I think we are closely watching each and every new strain and their clinical behavior.
Right. Dr. Vaishali, we've also seen, and this is something that Dr. Guleria, the former head of AIMS, also noted, that we've fallen back when it comes to testing and reporting of cases. Do you think this is very, very critical whenever there is a sudden spike in cases that is witnessed?
Testing is definitely required now that the cases are going up, and yesterday's guidelines have specified for the 6 states that we should step up the testing. So definitely testing is now required, and the 5-point program emphasizes on testing, tracking, and COVID appropriate behavior. So yes, we have to step up testing, especially in the 5 or the 6 states which are showing a higher number of cases.
Right. Any particular precautions that we need to take, Dr. Vishal, as far as incoming passengers go? This is a year when India is holding the presidency of the G20. There will be a very large number of delegates, large number of VIPs who will be coming into India over the next 6 to 7 months. Any extra precautions that we should be taking at this point?
I think the amount evidence.
All right. I think we're losing that connection with Dr. Vishal Rao. Let's see if we can get him back on. But of course, the emphasis of this panel is on the need for great amount of testing, greater reporting of cases, and greater precaution as well. Dr. Vaishali, coming back to you, any extra precautions that you're advising your patients to take? And at a government level, at a state government level, what are some of the key precautions that we must take, keeping in mind that this is also the year of India's G20 presidency?
So at individual level, I would stress that the high-risk individuals, and those high-risk individuals are those who have obesity, those who have heart illnesses, those who have chronic kidney or lung or liver failure, or those who are immunocompromised, say, for example, HIV or are post-transplant patients. These are individuals who need to take more extra precautions at an individual level, try and avoid crowded places, use mask, do not touch your face with repeated face and eyes and nose with hands, use hand rub, keep your hands clean, and if possible, try and avoid crowded places. So high-risk individuals definitely need to take more precautions as compared to normal, young, healthy individuals. Now, as far as at the government level is concerned, I think yesterday's meeting is an example of how having learned the lessons, the government is running ahead of the entire illness and of the peaks, and appropriate steps are being taken. The people should actually just comply with all those instructions. And as the government emphasizes on COVID appropriate behavior, the public need to take it seriously, need to wear the mask, maintain social distancing, and not have a behavior which will assist in the spreading of that virus.
All right. Thank you very much, Dr. Vaishali and Dr. Vishal, for joining us here, explaining us about the recent increase in COVID cases and what needs to be done in the days to come. Thank you very much, Dr. Vishal Rao and Dr. Vaishali, for joining us on this broadcast. We're going to take a short break here on News Center, but when we return, a Surat court finds Rahul Gandhi guilty of defamation in a 2019 case for targeting Prime Minister Modi for sharing his surname with fugitive businessmen Nirav Modi and Lalit Modi. Discussion when we're back. Welcome back. You're watching News Center. The big political story: a Surat court has found Congress leader Rahul Gandhi guilty in a 2019 criminal defamation case filed by former Gujarat Minister Parnesh Modi. So what does the defamation law really state, and where does this leave Rahul Gandhi as far as his defamation case is concerned? We've got with us senior advocate Sanjay Hegde. But before that, let's go across to Ashmit Kumar to understand the defamation law and what is the status of Rahul Gandhi now really. Ashmit.
Well, defamation again in focus on account of this development out of Surat. There are a few options that Rahul Gandhi has. We'll come to that in just a bit. But for the benefit of our viewers, just to go into what exactly the defamation law entails. Well, Section 499 of the IPC provides for defamation. As per Section 499, any imputation concerning any person intending to harm or knowing or having reason to believe that such imputation will cause harm, the reputation of such person is said to defame that person. That's broadly the legal definition of what qualifies as defamation. But what is critical here, and this is what is relevant to Rahul Gandhi, is the very subsequent section, Section 500. This is the section that empowers the court to slap a penalty, a fine, or a jail term of up to 2 years. Now, it's very seldom that we've seen convictions. The conviction rates are normally low in the criminal defamation matters, and very rarely have we seen 2-year jail sentences. But nonetheless, what are the options? Well, one of the consequences of this order, other than, of course, the obvious, which is the jail term, is disqualification as an MP. Now, Rahul Gandhi, under Representation of People's Act, will be facing a disqualification on account of this 2-year jail term. Now, what's important here is that under the RP Act, if a jail term of 2 years is granted, an MP stands disqualified, subject to a 3-year notice from the date of conviction. What is interesting here is that if Rahul Gandhi chooses to appeal this, which he likely will before the High Court, and if the High Court grants stay, then there is no question of disqualification. However, if the High Court refuses stay, then the question again arises. He may get disqualified 3 months from the date of conviction. As far as the defamation proceedings itself are concerned, well, it has broadly been criticized as a tool to, in fact, strategically intimidate and to silence criticism. This has been, in fact, subject matter of litigation. But what's important to note is that a bench headed by former CJI, led by Justice Deepak Mishra, has in fact upheld the constitutionality of criminal defamation. So the law is here to stay as of right now, courtesy that 2016 judgment. But of course, the debate rages on.
All right. Thanks, Ashmit, for joining us. Let's kick off this discussion with Sanjay Hegde, senior advocate. Mr. Hegde, coming to you, does the judgment in this particular matter, which has been delivered by a Surat court against Rahul Gandhi, for comments suggesting that why are all people with the surname Modi thieves? Is there a direct imputation, the direct imputation test, has that been clearly proved in the judgment? Do you think that is a point that Rahul Gandhi's lawyers could take when they go to a high court?
Well, I can't tell you what all Rahul Gandhi's lawyers will take or will not take. There would be more senior minds than mine who will decide that. But the point is that this was a public speech, and a public speech on political questions. So right now he stands convicted, not for defaming a particular Modi, but for defaming Modis in general. You must remember that here the complainant was also a gentleman called Modi. What further steps that Rahul's defense team will take? Obviously, they will go in an appeal. The question is whether the High Court will stay the conviction or will it only stay the sentence? Because then there are different consequences. If his conviction is stayed, then obviously there can't be questions of disqualification. But if it's only the sentence that is stayed, then probably from the High Court or it might even land up in the Supreme Court.
Right. It has been said, and it's often said, that conviction in defamation cases, the rate may be low, but these cases tend to drag on. And the people against whom these cases are filed, they do suffer on account of protracted litigation. How do you think this could affect his political prospects as an MP, considering that Lok Sabha elections will take place next year?
Well, I am not a politician. I cannot tell you how it would politically play out. But you must remember that when Mrs. Indira Gandhi, during the period that she was out of power, she was twice sent to jail. It only helped her. Right now in the US, you have President Trump waiting for an indictment. And it is said that he actually wants to be handcuffed so that he gets further votes and consolidates his base. How it will politically pan out, I do not know. But I must say that this judgment is rather unusual insofar as the severity of the sentence is concerned. The judge had an option of even fining. To say that, not all people called Modi are guilty or innocent, I'm not very sure that it actually runs afoul of the section. But those are arguments which will no doubt be made in court later.
Mr. Hegde, when it comes to the Supreme Court has upheld the validity of sections of the law relating to defamation and the punishment there. But give us a sense, if we go by the Supreme Court precedents, what is the test that the Supreme Court has successively applied to judge defamation cases?
I do not know of any Supreme Court case which has upheld a sentence of 2 years. Many years ago, even before I became a lawyer and I was accompanying my father to a court where he was representing somebody who had been sentenced for 6 months. I remember Justice Dawood of the Bombay High Court saying, "What? 6 months for defamation? Unheard of." So the statute, no doubt, is there on the statute book. It has been upheld constitutionally, but its application in such a harsh manner is rather unknown.
So would it be right to assume that as and when this goes into appeal, and the Congress has already said that they will be appealing against this verdict, do you feel that the High Court will now look at the test of direct imputation to someone? Was anyone directly hurt? Was there a direct personal injury to someone? And the severity of the punishment. Do you think these are two issues that will be taken in account at the High Court level?
It will obviously be taken into account. Every argument that is made will be taken into account. But, this only might end up spreading the question, are all Modis guilty of something or not? I do sense that there will be several people saying several things about Modis in general, which might be capable of more than one interpretation.
Right. When it comes to conviction, how strong is the conviction rate? It is often said that conviction rates in defamation cases are low, but what would be the rate? What would be the success rate in cases like these? How many of them get settled out of court or get thrown out of court, Mr. Hegde?
Most defamation cases, even when criminal defamations are filed, do not end in a conviction. Some of them, they get settled when people give an apology and the complainant withdraws. You saw that in the Aam Aadmi cases where there were defamations filed by Mr. Jaitley and a whole host of other people. Convictions are very rare in defamation. And particularly in a case where you have to prove an imputation and an innuendo. I do not think that Mr. Rahul Gandhi even knew that there was a particular Mr. Modi who was a former MLA in Gujarat and intended to say anything about him.
Right. And finally, a question on his status as MP. When does he get disqualified as a result of this judgment? And what is the legal recourse that he has?
No, the legal recourse will obviously have to be with regard to the judgment itself. If he gets a stay on his conviction, then there is no question of a disqualification. Otherwise, the parliamentary process of disqualification will happen. And against that, there might not be a legal recourse, because as far as Parliament is concerned, it is sovereign in its functioning within Parliament. But Rahul Gandhi will be in illustrious company. Right. You must remember that Indira Gandhi was also convicted by Parliament and disqualified after she had got re-elected from Chikmagalur.
Right. Thank you very much, Mr. Hegde, for joining us here on the broadcast, giving us the implications of this judgment against Rahul Gandhi and the status of defamation law and the success rate in defamation cases in the country. That's all we have time for on this broadcast. Thank you for watching. Goodbye.